So, I'm a very simple Ghatkopar boy. I grew up in a family who were first generation immigrants to Bombay. My father was a surgeon who did his education from Jamnagar, and he comes from a very small village, which was a village at that time called Morbi. And coming to Bombay, he settled down in Ghatkopar, which at that point in time was a very far off suburb. He was an extremely hardworking man and started the first surgical hospital in Ghatkopar and has worked his way up through various hardships to serve the society and perform various surgeries maintaining extremely high ethical standards. So, over the years, because of what he has done, he enjoys tremendous adulation and respect of the people around, and that is what motivated me to emulate him. He was my father figure, my inspiration to become a doctor. So in fact, there was never a second option. And a weird thing happened when I was actually applying for medicine. The pattern of examination of 12th standard changed, and one of my physics paper questions wasn't corrected because there was a missing serial number on my paper, and because of which I did not get medicine immediately. I did 6 months of engineering, but the moment I got it in the waiting list, I immediately jumped and became a doctor. And I think I don't regret it one bit. I always wanted to become a cancer surgeon right from first MBBS. And again, the way I think is I don't like to have a plan B, because once you have a plan B, your efforts towards plan A become dampened. I always wanted to be a cancer surgeon, and throughout my general surgery training, throughout my MBBS, I always dreamt of being a cancer surgeon. Perhaps I didn't have the maturity at that time to realize how easy or difficult it is or why I wanted to do it, but it's something that always fascinated me. I can't remember the incidents why, but that's what it is. I like the most is the impact that it has, not just on the patient's life, but on the families. We are able to touch thousands of lives through merely practicing our profession. And the other important thing is the patients who survive. I know that we are not God. A lot of patients may not survive because of the aggressive nature of the disease. But the patients who survive and keep coming back for follow-up, they come for follow-up not to be reassured about the disease. They come for follow-up because they start believing in you as their well-wisher and family member. That, I think, is the most heartening aspect of our profession. What I don't like is breaking bad news, be it regarding the aggressive nature of the disease or the fact that the patient has developed a complication which may be potentially fatal. Breaking this news down to the loved ones and the family is an extremely difficult job which I still haven't figured out. what is the right way to do. One of my teachers had once said that various people become cancer surgeons for various reasons. Some want to do it to earn a lot of money. Some want to do it to serve the people. Some view it as a sport where they want to excel at it and become better at others because every surgery is a challenge. Some have a more holistic view about it. Whatever the motivation, so long as you excel at what you do, just by the pure nature of the practice of the profession, you are changing lives. So I don't think there is one good reason to do it. I think there are several. Definitely not an easy life to be a cancer surgeon. More than us, I think it's the family, it's our family that makes huge sacrifices. There are several days in a week where I don't see my kids. There are several days in a week where my wife has to get up late just to give me a meal. There are several family functions, duties that I can't fulfill just to be in my profession. So definitely not easy. I think it's the bigger picture. You only have one lifetime to make a difference. I think my family, or for that matter, our families understand that, and they are supportive because they believe that what we are doing is making a difference. I get up at 6:30. I do a little bit of reading for myself, which is not necessarily related to medicine, which is about 20 minutes to half an hour. Then I might sometimes, if I have a light day, I might sometimes go for a jog. Otherwise, I get ready and leave house at 8 a.m. I usually finish my rounds, if possible, in the morning, and then majority and OPD if there is any, and then the rest of the day is surgery. Usually, I finish my schedule around 8 or 9 p.m. Although at least 2 or 3 days in a week, I end up finishing close to midnight. I think the one that I remember is there was a young engineer couple and the wife had advanced malignancy, and she had come in obstruction, and she had been told palliative care by every surgeon she had met. We did a cytoreductive surgery and HIPEC for her, and after that she lived for, I think, a good 3 years. Unfortunately, she had a very aggressive disease and it came back, but so at the end of 3 years, when she finally passed away, the husband sent me a very soulful message saying that we understand you are human and that you cannot cure. Cure is not in your hands, but you have still managed to give me the best 3 years of my life with the person I love the most. So I think that really touched me. There are several. I think in my branch I have cases practically every month which I can forget. My very first case of cytoreductive surgery is something which really sets the tone. She was a very, she's still here and I really love her. She was I think 60 when she came to me. She had a recurrence of a pseudomyxoma peritoni. I was a fresh surgeon. Uh, we probably didn't have the best systems in place at that time. She developed massive complications, spent 3 months in the ICU, had developed renal failure, had a cardiac arrest, had liver dysfunction, GI fistula, 4 surgeries, the works. She barely survived. And she went home with a bag. She came back for colostomy reversal at the end of 3 months. At the end of 6 months, she finally was up and about in the house. So she went home on a wheelchair, and it took her 6 months to start moving around confidently. At the end of 1 year, she called me in the evening saying that, "Doctor, I celebrated my new life first birthday with a 7-kilometer trek." So that is the difference we made in her life. She had a disease which was considered to be incurable. She had a very tough time, but she recovered and she did that. 5 years later, she got the disease back. And she had the courage and the conviction to come back to me for a third surgery. We operated her that time and she had 5 bowel resections, but she had an absolutely uneventful recovery and she went home in 10 days. 4 years later, she again had a recurrence and we again operated her, again 1 bowel resection, and she has fought and survived through all of that. She is now touching 70 and she is still as lively and sprightly as ever. Over the years, her family has become like family friends with me, and I really cherish this relationship. And I have several such, very recently I came in contact with a very nice guy whose mother-in-law I first treated. After that, 2 weeks later, his father got diagnosed with locally advanced cholangiocarcinoma, which is a primary tumor of the liver, which was initially inoperable. We started off with chemotherapy, and then following a decent response to chemotherapy, we operated him. It was a very complex liver surgery, and he had full faith in me to go ahead with the surgery, although he had the means to travel anywhere in the world to get the surgery. It was an uneventful recovery. What is most heartening is that over this period, we realized that both of us had very, very common interests and common lives, and we have become extremely thick friends, and we practically meet every week, in spite of it being a doctor-patient relationship, which to me has happened for the first time. So there are so many such incidents. I mean, I can go on and on the whole night.